Death as a consequence of rabies is one of the most unpleasant, distressing deaths that you could possibly have. People remain lucid and aware of their environment, but become horror-stricken by thirst, by even a breath of air or aggravating noise. And it is not something that I would ever care to witness again, and it should be prevented at all costs. Malawi is one of the poorest countries on the planet, and so its central funding is limited for all sorts of health needs and problems, including that of post-exposure vaccine, which is extremely expensive, and lacking in terms of resourcing for proper comprehensive canine vaccine programmes. And they've tried really hard with their minimal resources to do a best job, but yeah, it's not been adequate because of central resource limitation. We became connected with Mission Rabies through a series of communications with some academic vets in Scotland who put us in touch with Luke Gamble, who has just extraordinary energy and drive, and who had read a paper that was published in The Lancet a few years ago by the superb paediatric team at Queen's Hospital, including Mac Malawi and Neil Kennedy and Elizabeth Molyneux. And that illustrated that Queen's had a basis of some data on paediatric cases that would enable us to look and see whether the impact of a huge canine vaccine project could actually reduce the incidence in humans. So that provided Luke with the opportunity to say, let's go, here is a kind of discrete area, we've got some data on human cases, let's go for a really, really comprehensive vaccine programme and see if we can't have an impact on human incidence. So it was just a beautiful collision of people in the right place at the right time with enthusiasm and energy. And Mission Rabies has really pulled it out of the bag and brought all of that expertise and have done an extraordinary job over the past month in vaccinating over 37,000 dogs. It's just extraordinary. To know that this actually brings the possibility of stopping children unnecessarily dying with this horrendous disease. And I can't really express how I feel about it, because it's one of those situations, once the patient is ill enough that they're in front of you, there is nothing that can be done. And the sense of hopelessness is very overwhelming. So to be able to do something that's a preventative measure that's been proven to be successful in other parts of the world, including places like KwaZulu-Natal, is extremely faith restoring and gives me enormous hope that there is a possibility that we can eradicate human rabies. It is a ray of light in a situation of darkness, and I'm so grateful for it.